I just started recording. Pull up your study guides that you were sent in week 4 so you can take notes, please.
Okay.
Okay, I'm going to get started. Hi, everybody. Thanks for coming.
Hello.
Hi, Maria.
Hello. How are you?
I'm okay. I'm okay. Thanks for asking.
Where's my phone? Where's my phone?
You guys see my screen?
Yes.
Okay. All right. So I put some of my own notes in here that we're going to review. Okay. So exam 2, same as exam 1. If you're on camera or off camera, it's up to you. Okay, same thing as exam 1, except material weeks 4, 5, and 6. Okay, 50 questions, multiple choice, select all that apply, math problems, 5 math problems. 75 minutes, people accommodations get time and a half. I gave you some examples of what kind of math questions. Calculating a single dose, calculating a total dose, dose by weight, calculating meals per hour. I reviewed a lot. I have had a lot of student reviews over the past week, 10 days. A lot of people miss math questions. Okay. Whether it be 1, 2, 3, or all. So I've told everybody, and I'll tell you guys, I sent you a full announcement in week 1, full of math resources. All your instructors should have. Okay. So I really encourage you, if you had math problems incorrect, that you go back and review these simple math calculations and how to get to them. Okay, you really don't want to leave. I'm just going to stop sharing for a minute. You really don't want to leave these math points on the table for your exams. These are simple math questions. Okay, so please, one of the math resources, I don't know who just signed on with Samsung SM. You can't be in a car. Could you identify yourself, please? Ruth. I see Ruth's name next to it. Yeah, you can't be in a car. If is anybody else in a car? Can't be in a car. Anyway, Professor Bogart. I sent you guys, Professor Bogart does a tutoring session. It's on her YouTube. I sent you the link to that in week 1. Go on there. She does a very good basic tutorial of Math 101. You guys also have your Calculating with Confidence book in your student resources. Very basic math. I also sent you a link to Dean Brown. She did a tutoring session with students a few terms ago. Very basic math tutoring. So you get plenty of resources. Okay, so get yourself caught up on math. There's a lot of campuses that do math, have math tutors on them, whether they're your other professors, but please reach out to your campuses as well for math tutoring. Okay. Okay. Review math handouts. Case studies. We've done a couple of case studies. We did a week 3 case study, and this week we did a case study. So have a look at those. Make sure you look at your questions. I've already gone over with my classes using the highlighter, using the eyeball to cross out answers. Okay, you've got tools in your exam software and SamSoft software to use. Right? You have the calculator, you have the highlighter, and you have the eyeball to cross out answers. Highly suggest to use those. What I found in my reviews for exam 1, and I find a lot, is that couple of the most common mistakes is people are going too quickly. They're reading the question once. They're not highlighting the keywords or pointing or underline whatever the keywords. Okay, you're just going too fast. Okay, you got to read that question twice. First time you set it up, right? So the first time you read the question, you highlight the important words, cues, phrases in that question, right? And then come up with an answer. I always suggest come up with an answer in your own head. What would the answer be? And then go look at the answers. See if any of those are the answers. If it is if there is one, it's probably the right answer. Use that eyeball to cross out answers that don't make sense. Okay, then when you go back and do a second round with the question, you've got highlighted words, cues, phrases. And maybe you're only picking from 2 answers instead of 4. Slow down. People are going too fast. People are overthinking. You're adding words. You're adding things into the questions that aren't there. Okay, the only information you need to answer the question is in the question. If you're adding all this, well, what if this, what if that? Oh, I think I remember her saying that. All you need is in the question. And for goodness sake, don't change your answers. Okay, unless you have a concrete reason why you have to change your answer, like I selected the wrong one. I accidentally, my cursor went to B and it should have been C. Sure, I'm good with that. But don't change your answers for, well, I just had a student that I met with after class. We were talking about the quiz and she said, you know, I would have got a 10, but I changed answers 9 and 10. If I didn't change them, they would have been right. I would have got a 10 on my quiz. Okay. Do not change your answers unless you have an excellent reason to. Not, oh, I think I heard her say this. I think I read that somewhere. One of my classmates told me this. I think it's this one. The thinking thing is not, don't change your answers. Okay. What else came up? Select all that apply. Don't be afraid to select all. It can be all. It can be 2 or it can be 5. All right. So if you get to a select all that apply and all the answers you think are correct, select them all. Okay. Prepare. Watch. The fact that you're here is a wonderful step. But watch the recordings. You'll have 3 recordings. You already have 1 from Professor Ford. You'll have mine later on tonight or tomorrow. And then you will get Professor Kershaw. There's still 1 more live session after this Sunday evening. So prepare, carve out some time. Whenever you take the exam, whether it's Monday, Tuesday, or Friday next week, carve out some time to prepare. Okay. Hopefully you've taken good notes over the last couple of weeks in class. What else do we want to? Okay. So here's your concept guide. Here's my notes for you. Here's what we need to know. These are the most important aspects of each concept that I want you to review. I want you to review the facts about vulnerable populations. What do we know about them? Some examples. We know poor health outcomes, increased chronic illnesses, higher rates of communicable diseases. I'm just highlighting a few. The important, they're all important, but poor living conditions, poor dietary health. What else about vulnerable populations? What about teen pregnancy? What do we want to know? What are some considerations for teen moms? Are they at high risk? Yeah, of course they are. Why? Why are teen moms at higher risk?
Because their age.
Age. What else?
Their age.
Their ability to provide.
Yeah.
Lack of education.
Supporting.
Lack of support services, resources.
Yep. Sometimes they can't get jobs. Sometimes because of their age, they have to rely on their parents, and sometimes the parents are against them being pregnant, and they don't have the support that they need.
They're more vulnerable to violence, crime, abuse. right?
Yes.
Remember that? What else? What would be an example of primary prevention?
Education or
This is before they're pregnant, right? Education on the risks of teen pregnancies, right?
nutrition can be one.
Nutrition. Let's assume they're not pregnant yet. So we're trying to educate them. I'm a school nurse, so I go into the high school and talk about the risks of teen pregnancy.
Will birth control be considered?
Yeah.
Birth control,
control.
talking about birth control, exactly. Yep. Yep. Maybe if they're at screening, secondary, right? Maybe you're providing them places to go get a pregnancy test. They think they might be pregnant, right? They're at risk. That's what screening's all about. Early identification, early intervention, right? So we're screening for risk. Then tertiary, they're pregnant. What kinds of things, what kind of interventions do we want to work with them with?
Native vitamins.
Vitamins.
Folic acid.
What?
Folic acid, the absorption
Mhm.
of the
Nutrition.
nutrition.
Prenatal, what about prenatal care?
Prenatals.
Prenatal care. Having a solid support system. Right? Where do they get their support from? What are some short and long-term positive health outcomes? What do we want to do with teens? It's the most important thing we want to do with teen pregnancies.
Is it like
Continue their education.
Pardon me?
To continue their education.
Exactly. We want to keep them in school we want to keep them in school during their pregnancy and after pregnancy. Right? What do we know about long-term outcomes of teens staying with their education? They have potentially better outcomes
They
for
can
both.
provide a better future for their child.
Exactly. Yeah. Let's go through review the teaching plan for teen pregnant clients using experience in domestic violence. What's your teaching plan? What's your teaching plan with it?
Maybe the number like that they could call,
Yeah.
for advice so they can get shelters and stuff like that.
What about having a safe place to stay?
Shelter, credit cards, and
Shelter, credit cards,
A
extra
bag packed
keys,
with important items?
extra keys,
Yeah.
credit card.
Yep. What about let's talk about postpartum.
making sure that the mother has a bond with the baby.
What does that look like?
Like
assessing the growth of the baby.
Yeah. What do we want to see that's positive,
The relationship between the mother and the child.
right? Can the mom meet the needs of the baby? The baby's crying, the baby's fussy, the baby's cranky. Does she understand how to meet the baby's needs? Right? Is there good bonding? Is the baby feeding okay? Does the baby look healthy? Is the house calm? Is it efficient? Are things rolling along like they should be? Teen moms need a lot of support. What are your red flags?
When the mom doesn't want to hug the baby, or rejecting.
What else? Yep.
Yeah, lack of interaction with the child, desire maybe to not feed them, like breastfeed and stuff.
Maybe not bonding. Say that again. Bonding? Lack of bonding. Distractions. Is the dad in the picture? Is he supportive? Is it a chaotic environment? Is it a loud environment? Is it unhealthy environment? Do they have resources? Do they have help? Do they not have help? Are there other kids in the home? What's the dynamics? What are the dynamics going on in the home? All those things to assess, right? LGBTQ population. What do we need to consider? What are our considerations by the nurse working with this population?
Our own feelings.
Our own feelings. Whoever said that, excellent. And our own feelings might be fine. But if they're not, we need to work through them. Are there any existing thoughts or negative connotations or prejudices or biases against this population, or honestly any vulnerable population? Right? What's the best way to provide culturally competent care to this population?
Understanding our own culture.
Right. Understanding their culture as well. Understanding our own cultural beliefs, right? Our attitudes, beliefs. Understanding their cultural attitudes and beliefs. How do you provide a safe environment to assess the client and the family? What do you do?
Can you repeat the questions, please?
Pardon me?
Can you repeat the question?
I said, how do we provide a safe environment? How do we put this population in an environment that they can be open and discuss their whatever's going on?
We
Support,
can,
support
we
groups.
can, I'm sorry. We can, they said put, like notifications or things around the place of care that we do accept LGBTQ. We do treat
Excellent.
them.
Excellent. What kind of questions do we want to ask?
Open-ending questions.
What's an example of an open-ended question with this population?
What do you call your partner?
No,
How
well,
about, do you have a
I-
partner?
And do you
Yeah,
have a
do you
partner?
have a partner? Are you in a relationship?
Exactly.
would
Right.
you, what would you like to be called?
Exactly. What would your partner like to be called? Right. Exactly. We don't assume heterosexuality with this population, correct? Therefore, we can't be asking, do you have a boyfriend? Do you have a girlfriend? Right? The goal is to provide a safe environment for them to communicate their health needs. What are the recommended annual screenings for this population from the CDC?
STDs.
STD,
HIV,
HIV,
gonorrhea,
And I think,
Maria.
Herpes simplex. and-
is colon cancer one of them?
Chlamydia.
Mm-hmm. Mm-hmm. Yeah. Hang on. Okay. HIV, gonorrhea, herpes, syphilis,
Chlamydia.
chlamydia. Correct. Yep. Yep. Okay, and then what additional risk factors would we be looking for to increase that interval from a year up to, say, 3 to 6 months? There's 2 additional risk factors. What are they?
Professor,
Those
are
with
you
a
talking?
multiple or anonymous sexual partners.
Yep, that's one.
I'm sorry, can you repeat that, Maria?
And
Go
then using illicit drugs, right?
Yes.
Oh,
Those
okay.
are the 2. So these are annual screening recommendations. If this particular population or particular client within this population becomes higher risk, that annual interval goes up to 3 to 6 months. Maria just said what the 2 high risk factors would be considered: multiple sex partners and illicit drugs. Why? Why are those 2 increased risk factors?
Well,
Because
More,
they say
more
that-
exposure. Your
they said
inhibitions
that-
are down.
That's
exposure
it.
to
Yep.
HIV, to all of this.
Yeah, there's already risk factors
Transmitted.
going on. Yeah.
Yep, and like I don't know who said it, but she said that like when you use drugs, your inhibitions are lower. You're more prone to have unprotected sex.
I did.
Yep, good girl, Brandy.
Yeah, okay. Mental illness. Again, review the importance of self-awareness by the nurse when caring for a client with mental illness. Same thinking applies. Right? How do you feel about people with mental illness, whether it's phobias, schizophrenia, OCD, general anxiety disorder, mental breakdown? What else? I mean, how do you feel about it's hard. It's hard to work with patients with mental illnesses. It was hard for me in the schools to work with children with mental illnesses. It's hard. Right? But our self-awareness of our own feelings and attitudes and beliefs. You know, I always wondered, we have a particular school in our district that handles, these are kids that can't mainstream into their classroom. They have so many mental health issues that it prevents them from being successful in a traditional classroom. And I was the nurse that had that school, one of my schools. Right? And I saw everything. From kids starting out at 3, 4 years old all the way to high school. It's all it was, a school with kids with behavioral and mental health issues. So I needed to be aware of my own feelings. And of course, I embraced that population and wanted to be part of the team that helped these kids because the goal was to get them back to their home school and in their classroom. It's hard work. Okay. Let's say you're working with a patient that has bipolar and they've just started lithium. What are you going to teach them? What about lithium do we want to know?
Some stabilizers.
Okay. But what do we want to specifically? What are some teaching?
Encourage your water intake to
I'm about to say that.
2,500 to
Normal salt
3,000.
intake.
Yeah. Do we want to limit fluid or increase fluid?
Increase
Increase
fluid.
fluid.
Increase.
Have to keep hydrated.
Pardon me?
You need
Keep
to
them
keep yourself
hydrated. Yeah.
hydrated.
Yeah. What about salt intake?
Normal salt intake.
Normal. And what kinds of GI symptoms? There's GI symptoms we want them to report.
Decrease.
Diarrhea.
Okay, yeah.
Diarrhea, vomiting.
Diarrhea, vomiting, tremors, lack of coordination.
Yep. Any kind of tremors or shaking or change in mental status, change in mobility, gait, right? Let's say you're working with a couple of things, a couple of illnesses I want you to be aware of to take a look at. And I should have put that in here, but I didn't. Take a look at general anxiety disorder. Take a look at bipolar. Take a look at OCD. Take a look at, and just be able to tell a difference. If you're presented with a scenario of a client presenting with this and that, what is it? Is it a client that may be OCD, client with general anxiety disorder? Okay, so OCD, bipolar, general anxiety disorder, phobia. Know what a phobia is? Okay. And then the other mental disorder is suicide, suicidal ideations. Okay, speaking of taking care of a client with suicidal ideations, what's the biggest concern?
Safety.
Safety. What are some appropriate questions to ask a client that may be having suicidal ideations?
Do you have a plan?
Do you have a plan?
Mommy, I wash my hands.
Have you attempted before? What's your support system like?
Mommy.
All right, come on, let's go sit down.
What else?
Maybe do we ask them what makes them feel like
Have you attempted
Acting on
suicide
it.
before?
Have you attempted before? Do you have a plan? So reviewing actions, I'm sorry, I don't know if you can hear that weed whacker in the background. Sorry about that, can you?
No, I can't hear it.
He was supposed to be done hours ago. Um, review what actions need to be taken for caring with a client experiencing DTs. So alcohol withdrawal. Again, what's the most important consideration?
You said safety?
Safety. What are DTs?
Delirium tremens.
Mhm.
That's, shaking and all of that.
Shaking. It can be similar to looking at somebody having a seizure. Right? So you want to take a look at seizure, safety precautions. Alcohol, tobacco, and other drugs. Know about nicotine ingredients. Okay, I think about vaping. What's so dangerous about vaping and e-cigarettes?
The
Cancer.
Or
oil.
poisoning?
The oil.
The
The oil.
oil. What's wrong with the oil?
It's poisoning to the
Poisoning.
kids.
What's near to the kid?
Absolutely. Right? So if you've got a parent that you're working with trying to teach about nicotine cessation, they got kids with asthma, they smoke, and the parent says, "Oh, don't worry, I switched to vaping. I switched to e-cigarettes." Is that okay?
No, it was
No.
same thing.
No.
I had a friend who used to vape and she used to cough and all of a sudden she stopped vaping and I said, "What? You don't have your vape with you?" And she said, "No, I had to stop." I was like, "Why?" And she said her doctor told her she was drowning because she was getting a lot of that moisture in her lungs.
Absolutely. Yeah. So let's talk about primary and tertiary points for teaching. What will we do? For me, my primary interventions in the schools were to teach kids ahead of time about the dangers of smoking, the dangers of using nicotine, right? But let's say they already smoke. What are you going to do? Find them resources, maybe cessation programs, right? How can you help them quit? The goal is getting them to quit. So they're not a long-term smoker. How do we determine the blood alcohol level? Is it by the amount they drink? Only?
Is the age, the gender? I think it is.
Metabolism?
The metabolism, yeah.
What else is considered?
Wait.
Weight?
The weight, yeah.
When did they last eat? Right?
And the background.
What?
The background too. Because sometimes they have it in the plot. It's the
Yep.
parents.
So my point is that there's not just one thing that determines blood alcohol concentration. Please know all the different factors of what goes into it. I think there's 5 of them. The other thing I need you to understand is drugs, other drugs. I want you to review cocaine toxicity. I want you to review methamphetamine, amphetamine toxicity, opioid toxicity. Hang on a bit. And alcohol toxicity. What do these look like? Remember, this is clinically based, right? We're taking your knowledge and we're putting it into practice. So a patient presents to you with sweating, heart rate, whatever. What is your assessment? This could be opioid overdose. This could be fentanyl overdose. This could be cocaine overdose. Alcohol withdrawal. Maybe they're going through alcohol withdrawals. So right here. So review assessment findings for client using amphetamines, methamphetamines, cocaine, opioids, and alcohol. How do you manage a patient with alcohol withdrawal? And be reorienting them. There's part of that is confusion. Part of that could be DTs. Their mental status is affected. Then I want you to review how do people become dependent on alcohol, tobacco, other drugs? How does dependence occur?
Probably because they losing their jobs.
Yeah.
They in poverty.
Maybe lose their family.
They lose their family. Some issues in the family, like somebody, I don't know, something like that.
Criminal
Criminal.
issues, law
The
issues,
neighborhood.
neighborhood. And then
The
what are the
friends.
benefits? What's some harm reduction? Harm reduction meaning reduce the risk. What can we do? Think about that. I just want you to think about it. Okay. Hospice. Review the stages of grief. Okay, you'd be given a scenario of a certain family acting in a certain way. What stage of grief is this family member in, or this patient in, or this child in? Okay. Why is autonomy so important in hospice nursing, providing the client autonomy or the family autonomy? Why is that so important?
Respecting their
Their feelings,
Their rights.
still giving them a choice because they don't have really much to choose from.
Exactly. Exactly, Tacola. They've already lost so much control, haven't they? Autonomy is something we want to focus on as much as we can. We want the patient as client involved as much as possible in whatever their end stage plan of care is. What's the difference between hospice and palliative care? What's palliative care? I mean, there's mostly similarities, but what's the one big difference?
Palliative is like comfort, and hospice is like the end.
The end of life.
Right. Well,
So
they both is like comfort, though. I can't really say it. I don't know.
So let's say I was diagnosed with cancer today and I have a year to live. The next year is going to be palliative care, right? And then when the determination is made for me to go into hospice,
It has to be
Management.
6 months or less that you're gonna die.
exactly. What are the priorities? What do we want? What do we want to accomplish in hospice care? What are our priorities?
Keeping the
Controlling the
patient
pain.
comfortable and
Less
pain-free.
pain as possible.
As possible.
helping them to remain keeping their dignity.
Yep. That's exactly right. Everything everybody just said is exactly what we want to be doing. What might you see? What observations? What physical observations might you see at the end of life?
They don't
Imminently.
eat anymore.
There's gasping for
Restlessness.
air.
Refusal of meds.
What about their skin?
Food is like,
Dry.
Dry.
Weekend.
What about their neurological status?
Uh,
They're talking out of their head.
They
They're talking
delete-
about
their
the
respiration
past.
is shallow.
they hallucinated. They kind of delirious.
Used.
Respiratory. Somebody just mentioned it. What are you going to see respiratory wise?
It's gasping for
Down.
air.
Breathing.
Shallow and irregular.
They don't breathe properly.
Hard breathing.
Low.
Spirituality and culture. Here's a couple of cultures I want you to review, whatever values, beliefs, practices. I want you to review the African American culture, the Hispanic culture, the Native American, and the Jewish culture. What are their preferences? And I mean simple preferences. Food preferences, care preferences, What else? What other kinds of preferences? How do they like to be treated? Are they past, present, future focused? Remember that whole past, present, future? If you're so focused on the past, you really can't focus on the future. Right? If you're so focused on the present, you can't look ahead and anticipate. If you're so focused on the future, you have no idea what's going on in the here and the now. Right? So what are some cultural differences between these cultures? Okay, what is culturally competent care? If
Being able
we,
to understand your clients.
okay, understand
Is-
what?
Is care provided as close
Their-
to their
Their-
preference as
their preferences
possible while still
and the
helping them?
culture.
Every client is unique, right?
Mhm.
Being culturally competent is a lifelong process for us as nurses. I'm still learning to be culturally competent with cultures that I may be a bit unaware of. But over my 40 years in nursing, I've learned about a lot of cultures and I've become very culturally competent with cultures I've been caring for. Hey, I'm able to look at the client through their eyes, from their perspective. Do I expect to be treated like they would want to be treated? Probably not, because cultures are so different. It's the ability to look at everybody individually and through their eyes and try and incorporate as much of their culture into their whatever their plan of care is.
Mhm.
And it's nothing that we master. It's a lifelong learning process of mastering this. But as long as you have the effective tools to know what you're striving towards, right? This is the culture I don't know much about. What can I do to learn about it? Ask, read, research. Okay. Language barriers. What do you do with language barriers for cultures or populations? What do you do?
You use like not hotlines, like
Interpreter,
language lines. Yeah.
translators.
Sure. Translators, number one. Translator's the best. All right. If you don't have translator, you have other options. Okay. But language barriers are huge barriers. Okay. We just talked about this today in class. Trying to provide the client information in their home language is the best way. Flyers, pamphlets, webinars, podcasts, whatever, in their language, right? Because they're not going to learn the English language overnight, and I brought up the example today in class, sometimes you call a big company, whatever, English press 1, Spanish press 2, Russian press 5, Vietnamese press 10, we have to be able to try and provide the language, primary language to understand their culture, right? Or if we're going to learn about their culture and they cannot speak our language, how are we going to know about their culture? How are we going to know about what their needs are, what their wants are? Okay. Ethics. So we're always in ethical situations, whether it's our personal life, our family, our work, kids' school, kids' sport, whatever. There's always ethical things we're thinking about. Remember, ethics is doing good, right? What would any reasonable person in your situation do? We would try and do good. Okay. So think about ADPI here. What is the very first step in ethical decision making?
To identify the ethical issues.
What's the issue? Right? You got to identify the issue before you can come up with a plan. Right? And if you think about it informally, let's say you're having an issue with one of your kids' teachers. Right? What's the issue? Right? What's the issue? You first have to do that. What if there's an issue with a client at the hospital and the nurse that's taking care of them. What's the issue? Is it language? Is it attitude? Is it workload? What's the issue? Because obviously with ethics, ethics means do what's right, do good. And that's what these ethical principles of beneficence, do good. We're always trying to practice beneficence in our lives. Personal, work, beneficence, do good. Non-malfeasance, do no harm. So the quiz question that came up is, you're cathing somebody and you contaminate the field. What do? You go get a new kit and start over. Do no harm, right? Not doing that potentially creates harm. Distributive justice, that means everybody should be treated equally. Let's say you have a pool of resources in a community. Everybody should have equal access to those resources. Distributing justice, distributive. That's an ethical principle. And I have an and here, and that and is autonomy. I can't spell. Is that right? Autonomy. Right? Giving people their voices. Letting them participate. When we document in a client's chart, is it objective or subjective?
Objective.
Objective.
Okay. What's an example of give me an example of objective charting.
A fever of 102.
Fever of 102. Go ahead.
Vital signs 180/65.
What else? On a scale of 1 to 10, patient reports pain is a 5.
Yep.
What are some examples of subjective charting that are not correct?
It is when it is from the patient
Feelings.
telling to you.
What else? Patient appears to be cranky today.
That's subjective.
Of course. Family members seem to not get along with each other.
It is
Family
subjective.
members seem to not agree on the patient's plan. Subjective, right? There's a difference between objective and subjective. You can only chart objective things, factual. You can't put your opinions in there. Patient seems cranky this morning. Well, do you know what happened last night? I don't know. Maybe they didn't sleep. Maybe they're stressed out about their new diagnosis. It's not up to you to form an opinion. Well, you can form an opinion, but to document that, you wouldn't.
And they could be frowning because the light may be in their eyes or something.
Exactly. So charting is objective. What about floating? So anybody never been asked to float to a unit they have no clue what to do on? Has anybody never been asked that? Of course you were asked that. Right? Legally, we need to float. I mean, I guess unless you have a union contract with your hospital or organization that says no floating. If you do, that's great. But if you don't, we have to accept that floating job as much as we don't want to. However, how do we make sure that we're not putting patients at risk? How would you handle that? Here's the right answer. You handle that by talking to whoever's floating you or whoever's accepting you, right? Because they all practice their ethical principles as well. You know what? I'm here. I'm Kathy. I'm here. I've never been to this floor. I don't know how to care for pediatric patients, but here's what I can help you with. I can deliver trays. I can change beds. I know how to transport patients. I can assist somebody walking to the bathroom. Here's what I cannot do, because it will put the patient
In jeopardy.
in jeopardy. Does that make sense? So there's a right way to float, there's a wrong way to float. What can you do to contribute? Versus, I don't want to be here. I'm not doing anything. I don't know how to do anything. Sure, there are things you could do to help. Right? Okay, and then this week we covered occupational environmental health. What populations are at risk for environmental hazards?
Child,
Children.
Kids. Who else?
uh, pregnant women's,
Pregnant women. Absolutely. Who else? Elderly.
elderly,
Maybe immunocompromised.
immunocompromised too.
How do we do a safety assessment in the workplace? Whose job is that?
Is it the health and safety nurse?
The occupational
The
nurse. Yeah.
occupational therapy, the occupational nurse.
Yeah. What does
Yeah.
she need to know to do accurate safety assessments at work? What does she need to know?
The work environment safe.
Yeah. Looking at job descriptions. What are people required to do in their jobs? Do they have all the training they need? Let's say you're in the Department of Transport and you're lifting and transferring patients all day. Do you know how to lift? Have you had the proper training on lifting appropriately so you don't have back injuries? Are you working in a plant that is real noisy? Do your workers have hearing protection, proper PPE? Are you working in I brought this up today, you working in the OR? Do you have the appropriate PPE, goggles, appropriate clothes? Do your people working with heavy equipment know how to use the equipment? Do they know how to use the chemicals they're using? Do they know how to carry out their job description in a safe way? Occupational nurses pretty much do everything. Primary, secondary, and tertiary. Primary, they're always working to prevent any kind of work injury, making sure people are safe at work. They're always screening. Screening for what? Hearing loss in a large plant. Screening for TB when you first start a job. Right? Then they're always working with people. Let's say something's happened, it's tertiary. You've had a job injury or you've been injured outside of work. Let's say you have a new diagnosis coming into work. Maybe you have a new mental health diagnosis, or you had a car accident, you have a TBI. Can you function in the current job you just left, or does she need to figure out, do you come back limited duty? Can you even come back at all? And what training do you need? All right, so the occupational health nurse has lots of roles. Educator, enforcer, actually. Case manager. Somebody's been injured on the job or outside, they're coming back to work, working with all different departments. Human resources, the doctors, whatever, physical therapy, occupational therapy. What are the restrictions to come back? Somebody's got to coordinate all that, right? That's your occupational nurse. And then client teaching, the 3 domains of learning. We talked about this week. Cognitive, affective, psychomotor, right? Your cognitive is your thinking. Can you take all the information in, learn from it, and make decisions from that? Affective is your thinking. What are your attitudes and beliefs about what you're teaching or what you're learning? Do you buy into it? Do you not? Is there a lack of motivation, lack of self-awareness, lack of self-confidence, right? How do your attitudes and beliefs play into your learning? I gave the example today. Let's say you have to go to an annual in-service. You have to go every year. And it's just, you can't believe it's been a year and you have to go again. And it's useless, you think. You're probably not going to be in a real good, what if there's new information that's going to be provided, but you already have the attitude that, another in-service, right? That's how affective, that affective domain kicks in, and your attitudes may hinder your learning. Or let's say you're teaching a group and people's affective domain is kicked in and they don't want to be there and you're the teacher. How do you rein them back in? And then the psychomotor is the doing. The example is the new diabetic that wants to figure out how to do his own blood sugars. Right? It's the doing. All right. It's showing him teaching back to you. Okay. There's some scenarios on the exam about different ways we learn. Can you identify an affective, somebody who you need all three domains, actually. We have all three domains within all of us, but some of us are cognitive learners. We have to think about things. Some of us, our attitudes and beliefs affect the way we learn. A lot of us, I'm a hands-on learner. I'm a psychomotor learner. Don't tell me how to use the clicker on my TV and get to Google something, YouTube on my TV. Don't just tell me how to do it. I can't figure it out. Come over, one of my boys, and show me. I can't do directions on the phone. You got to sit with me with the clicker and figure out how to get to Apple TV. I don't even know what you're talking about. Make sense? But everybody possesses all three, but usually one or two are much more prevalent. And then barriers, last thing, barriers. What are some identified learner-related barriers? We talked about this week. Literacy. That's not meant to be punitive. It just means that a lot of people don't have a whole lot of health literacy. How do you teach people with low literacy? Maybe it's a language barrier. Maybe it's a cultural barrier. Maybe it's an immigration barrier. How do you reach the visually or auditory impaired people and teach them? How do you reach the people that aren't motivated to learn, but they really do need to learn? Like, let's say you're doing discharge teaching with somebody that's had a stroke. And they're like, ho hum. Okay, yeah, just go through with me. I just want to get out of here. I want to go home. I've been here a week. I got to get out of here. So just give it to me. What do you do with those kind of learn? I mean, you're tasked with numerous kinds of barriers, whether you're the teacher, the educator, teaching a group for something preventative or primary versus tertiary. You're discharging people with conditions, diseases, post-surgeries, that there's information they need to understand. A lot of challenges. So, okay, well, that covers all the concepts. Is that helpful?
Yes.
We went through everything.
Yes, ma'am.
Okay, fantastic. Does anybody have any questions?
Thank you.
Just
I do have a question.
just do your due diligence. Carve out some time for community. Okay? If you're coming to class, you're paying attention, you're doing well on the quizzes, means you're preparing for class. If you haven't done well on the quizzes, are you understanding when we went over it? Do you understand it now? If not, go back to the readings. There's lecture recordings for weeks 4, 5, and 6. Just go into your announcements. You have your math resources. You have all the tools necessary to succeed. And in the end, next week, if you're still struggling, reach out to your instructor and schedule a tutoring session to go over whatever you're just need a little bit more review. Okay, I'm sorry to interrupt. Who had a question? I apologize.
It was me. I was just making sure that this was uploaded as well, correct?
No, no. I have not. You guys have a blank copy.
No,
right?
I'm talking about this recording.
Oh, yeah. Yeah, you guys have a blank copy of this review. My goal in my reviews is I put in some notes for myself and share with you on the screen and expect you to take good notes. Okay. I hope this has been helpful. I really appreciate you guys attending.
Thank you,
And
Professor.
good,
Thank you,
Yes, thank
Professor.
you.
yeah, good luck on exam 2. You got this. You guys got this.
Yes, we got this.
Absolutely. Absolutely.
Miss Marvel.
We don't have any peds excuses this time. Okay? Peds, it's always the exam 1 for peds and community is always in the same week. It's a struggle, I get it. But exams 2 and 3 are not. They're in opposite weeks. So no peds excuses this time. Just get her done. Get her done. Prepare.
Thank God.
Do your due diligence. Yeah, I know. Do your due diligence and then reach out to your professor. Okay?
My first week exams, I had first week we had mental health in week 1. And then the next day was leadership exam, and then following that was community exam. It was like back to back to back.
This,
to back.
I say this in week 1. This is an incredibly difficult term. I fully
Yes.
acknowledge that. Most of you are taking 3 classes, some of you are taking 4. And that's why I really reiterate in week 1 that if you ever needed to have your time management, organizational skills at top notch, it's this term. I get that. I get
So
that.
have a nice weekend, Professor.
All right, you guys too. Somebody had their hand raised.
It was me. I just had a question specific to our class, I guess. Is there a specific way you want us to do this or just do it?
Your HESI prep?
It's the heavy.
Yeah.
Uh-huh.
Yeah. I mean, the directions I think are pretty clear. Treat that as a clinical scenario. You assume you already have, assume you already have the knowledge, and now you're going to take care of a patient with anthrax, which is the first box. What do? What might they present with?
Regarding to that,
Okay.
when we supposed to submit it?
It's week 9.
Okay, but we can
To
submit
get-
it anytime?
Yeah. You can submit any time, but don't wait till week 9 to do it. It's going to be a
Yeah,
cumbersome.
no, because I'm almost done. I just
Yeah,
like I had like
submit
3
it.
more to go and that's
Yeah.
it.
Submit it.
Because I've been doing it, you know.
Yeah, that's exactly what it's designed to do, is work on it all term, because really it's your HESI study guide. This is what you're going to use to study for HESI.
Yeah, I had 3 more to go and that's it. And
Yeah.
I'm done.
If you're going to get out of that what you put into it. If this is something you've been working all term, great. If it's something you're going to put together at the last minute, you're probably not going to get a lot out of it.
It's a little kind of difficult, but it's fine.
It is hard. It is hard, but guess what? It's your study guide. Every single one of those boxes represents a topic that's covered on the HESI.
Yeah, but I had to rewrite that thing
I
so
know,
many times.
I know, but you know what? Udelka, you'll thank me later.
Yeah.
Promise. Our average on the HESI last term for our January students was an 83.
Yeah.
And I always do in week 12, I do my debriefing with my classes. We don't need to talk about that now, but we won't be coming you guys will have to come to Monday on week 12. There's no class on Friday. We'll talk about that later. Anyway, when I do my debriefing, the HESI prep assignment really helps students prepare for HESI.
Yeah. Mm-hmm.
So, all right, somebody else,
Have a nice weekend.
Yvette, you've had your hand up 3 times and I keep putting it down.
Yeah, don't worry. The other 2 questions, I don't even remember what I was going to ask you. It was like,
Shoot me an email.
but anyways, this one is about the HESI assignment. I just been like getting the information straight from the book.
Your book, lecture, case studies, discussion questions. Lots of places to get it. Don't Google. Just don't Google it, okay?
Oh, no. You
Don't
cannot
Google
Google.
it.
You know, I
Don't
get
Google
nothing.
anything. It's in your books.
Yeah.
And
Okay.
You get nothing.
a lot of these boxes on your HESI prep are med surge. I've already said this in week 1. This HESI is very med surge focused. And one student told me last term, she scored like over 1,000 on her HESI. I said, what'd you do? She said that she went back into her NCLEXs while she reviewed her CJ Sims and her other classes, because that's a lot of how things are presented, right? She went back and did lots of extra NCLEX questions. She went into the study mode, right? And she said she did 50, 100 questions a week. Adult health. She did a lot of adult health questions, adult health med search questions. she did pediatric questions, and she did mental health. She said she did over 1,000 questions over the course of the term. Not saying you need to do that. All I'm saying is with the adult med surge, she got all her reviews by doing extra questions in those study areas. I think she was taking 3 other classes too, but she ended up, I'm not saying you have to do that, but you have the resources of that. You have the resources to be successful on the exams all the way through the HESI. You just got to use them. Okay.
Thank you. Have a good
That's
night.
good advice.
Does that
Thank you.
answer your
night.
question,
Thank
Yvette?
you.
Yes,
Yvette?
yeah.
Okay.
I've
all
been
right.
finding actually all of the topics in the books. I mean, yeah, you have to have
Yeah.
more.
Oh, yeah. They're all there. Yeah.
They're all in there.
All right. You guys have a fantastic weekend. Thank you for coming, and reach out to your instructors if you need anything. Okay.
Yes, thank you.
You're very welcome.
Thank you.
You're welcome.